we need one-stop endometriosis clinic. One-stop endometriosis clinic means that the GPs, if they suspect a person suffering with endometriotic pain or symptoms associated with endometriosis, they will be able to refer to that place where we have 2 or 3 GPs with special interest in gynae. Yes, we will have 2 or 3 consultants who specialize in endometriosis. We will have in-house abdominal scan, transvaginal scan, MRI, and also the 3D scan, which is 87% sensitive and specific. So with that, we can make an early diagnosis. Once we make an early diagnosis, the first line management, I'm part of the NICE guideline. NICE stands for National Institute of Health and Clinical Excellence. So they make guidelines for every disease areas. The last one updated on endometriosis was November 2024. So as per guidelines, we can start the first line management. The guidelines clearly say that all patients with suspected endometriosis should be seen in 3 months' time. In a routine GP surgery is simply not possible. So one-stop gynecological service will see these patients in 3 months, and if there is progression of symptoms, they can be referred to the specialist center. Now again, a specialist center, I mean every area should have a tertiary specialist center on endometriosis. So tertiary center means a gynecologist who has got skills in laparoscopic surgery. There should be a colorectal surgeon in case it spread to the bowel. There should be a urologist in case it spread to the bladder or the ureter. There should be an MDT on pain management, and there should be fertility service provision as well, because some of these women can't get pregnant. So if we have a tertiary center which can provide all these services, things can be sorted. So one-stop endometriosis clinic is one thing. Number 2, we have to have QOF. QOF is Quality Outcome Framework. Quality Outcome Framework was introduced in 2004, and it rewards the practices of providing quality care. So there are points in the QOF. The points are, at the moment, we've got 536 points. 1 point gives me £225 in my pocket. And if I achieve all the points, I get about 220,000 every year. With that money, I can employ a nurse, I can employ an ANP, I can teach and train them like I teach and train about the asthma delivery service. If I get points for my hypertension, I get about £7,000 every year. And yes, I don't do the hypertension or blood pressure check. I've trained a nurse. She does it, delivers the service, and yes, I benefit from her input. So if I have QOF in endometriosis, other GPs will update themselves, will update the allied healthcare professional. The other staff, reception staff, will be updated as well. So we improve the service provision of the women, and also the GPs would be happy too. There will be less time to get the diagnosis. Number 3, when it comes to women's health, there is no funding for research. Why is there no funding for research? When it comes to men's health, there is plenty of money. So my book on endometriosis in primary care is going towards University of Manchester. So they are doing a research. They are developing a hydrogel which will deliver the drug to the endometriotic deposits, which means the deposits disappear and the hydrogel is excreted in the urine with no side effects at all. So if that gets affected, if that consultants want to use it, then yes, the treatment can be delivered early. Women's health has always been ignored. Even though we women make up 51% of the population, the health and care system, like I said before, has been designed for men, by men. So if you look into all the research the clinical research, the evidence, and the data only goes towards men's health. So why women's health has been ignored? That's the reason why there is so much little knowledge about women's health, especially endometriosis. There are so many men who have never heard of this condition, who do not know what it means. So why is that? If we women are not well, we can't go to work. We can't deliver to the community. We can't deliver to the nation. So our health should be treated as equal as a man's health. So why co-op is not in women's health? None of the women's health area has been covered in co-op. I have written a book on co-op as well, which was about 6 years ago. And I did mention in that book, we have to have endometriosis, menopause, infertility, repeated miscarriages, you name it. There's so many disease areas. Let's start with endometriosis because it's taking how many years? 11 years to get a diagnosis. Can you live with suffering of those symptomatology? Debilitating pain. Pain is so debilitating that you can't get out of bed, can't go to work. The routine painkillers do not work. They are on strong analgesia, which has got side effects. Then they've got associated symptoms with that. They start bleeding when they are passing urine. They start bleeding when they are opening their bowels. So all these things are affecting their mental health. Can't get pregnant, infertility. Have we got any management towards infertility for these women? In North, they only get one cycle free. Why? In South, they get 3 cycles free. So women, why in the North are being treated badly as compared to South? Why? Why we are in a country where your postcode is determining your health. 11 years is taking in North, and in South, 9 years and 4 months. So women's symptoms are being dismissed, ignored, and belittled. Not anymore now. We need a service change. Yeah. So what I want is one-stop endometriosis clinic. One-stop endometriosis clinic means that a patient with suspected or confirmed endometriosis comes to that clinic where we'll have 2 or 3 GPs with special interest in gynae, consultant who are specialists in endometriosis, diagnostic facilities like abdominal scan, transvaginal scan, or 3D ultrasound scan, and MRI scan. The emphasis is on making early diagnosis so that early management can be started. As per NICE guidelines, we would know exactly what treatment to offer. As per NICE guidelines, we will review these patients every 3 months to make sure that their symptoms are well controlled. And if there is suspicion of spread of endometriosis to bladder, bowel, or to the lungs, we would know where to refer these patients to a tertiary center where there will be clinicians who are expertise in dealing with endometriosis, which means a consultant endometriosis specialist, a colorectal surgeon, a urologist, MDT for pain management, and for fertility management. One-stop endometriosis clinic will achieve our mission of early diagnosis and early management and regular follow-up. Number 2, what I want is QOF, Quality Outcome Framework, in all the gynecological areas. QOF was introduced in 2004 and it rewards practices of providing a quality care. So we have got QOF in hypertension, asthma, COPD, diabetes, every disease area. But why is there no QOF in any of the gynecological areas? If we introduce QOF, the GPs will update themselves, they will update their staff as well, they would be able to provide the guideline service provision, and things would improve from women's point of view. Also, we want funding for research. Unless we get early diagnostic tests to detect endometriosis, we will not be able to move faster. I think the time has come now that we have to run. We have to run. We have to make an early diagnosis and early management. I've written a book on endometriosis in primary care, and the money raised from the sale of the book is going towards University of Manchester, who are involved in research of endometriosis. My previous book, Gynae in Primary Care, was in 2014, and I won the first BMA prize. So since then, the publisher has been asking me to write more books on gynae. And then we need funding we need an early diagnostic test, blood test or a saliva test, and other markers which are developing, but I want it coming out in the market sooner than later. So this is my book, Endometriosis in Primary Care, a practical guide. This book is meant for GPs, for secondary care, because there are chapters on surgical management, and also for patients as well. I've got one chapter which Lucy and Courtney's stories are there, and their partners and dads have also contributed. We need funding for research, and this book, the money raised from the sale of the book is going towards University of Manchester. Professor Marshall and her team is involved with the research of endometriosis, developing a hydrogel. So I'd like all of you in this room to buy the book. Thank you.
No one listens, no one cares, it is what it is.
I wasn't believed for such a long time.
I don't sleep.
I was constantly dismissed.
Soft or dramatic, nothing wrong with you. It's like more of a stabbing type of
The surgery was about 8 hours long. I had sort of like some stents.
Dismissed by doctors, not investigated. It was only when I went back to see a female doctor that she referred me for an x-ray. And
They just think you can't handle it.
I'd been going into work,
That sort
with a
of
broken
thing.
rib.
And women, doctors and surgeons,
was bedridden.
because if they don't
My
experience
parents
what
became
you
all full-time
experience,
carers
it's
because
all in your head.
even things like eating was impossible some days, and showering for myself, I was just in that much pain all over my body.